Hello everyone, my name is Suhan, Doctor of Physical Therapy. Are you experiencing any pain over the top side of your foot? Then if you do, then this video is for you, so stay tuned. When it comes to ankle or foot pain, we often think two common diagnoses. There are ankle sprains and plantar fasciitis. But if your pain doesn't quite match those descriptions, you might be wondering what's going on with your foot. This confusion happens a lot with this condition. The pain can come and go, getting better with rest within a few days without needing any specific treatments. However, it can also become chronic and lead on to other issues down the road. There are three key conditions that you need to consider for effective treatment. First condition is if your pain is worse by wearing a shoes, especially if they're tight. Second condition is you have gradual onset of aching pain and swelling at the top of your foot or front side of your ankle. And third condition is you perform dorsiflexion, which is going to be your foot moving up towards you, and you're gonna struggling with moving your foot without your toes moving upwards. If you meet all those findings, then we're suspecting extensor tendonitis. It is a diagnosis that indicates inflammation over the tendons for extensor muscles over your foot, and those extensor muscles can bring your toes upwards as well as your moving upward for your foot. So what can we do about this? Here I have three recommendations that can be very highly effective. So here we go. So first thing that I recommend is to avoid wearing shoes that has low ceiling or wearing tight shoelaces. Low ceiling shoes or tight shoelaces will compress over extensor tendons, especially if you have swelling over the top. So avoiding wearing running shoes or loosen your shoelaces can definitely help to manage your pain. So second thing is to improve your tibialis anterior muscle strength. There are many extensor muscles that will help to perform dorsiflexion, which is your foot moving up. However, if the motion is performed along with your toes moving upward, then that basically means your extensor digitorum muscle is dominating the motion, not so much by your tibialis anterior muscle, which is not normal. In that sense, we need to strengthen the tibialis muscle so that it's actually activating without your toes moving upward. We can strengthen them by the muscle by holding the toes and bring your foot upward towards you. It is okay if your foot is moving slightly inward, since that muscle also inverts. When you feel your muscles over here, then you're doing it right. So I want you to perform, in that sense, we want to perform 3 sets of 10 repetitions. Third thing that we will do is strengthen your fibularis tertius muscle. When you look at your foot and notice your fifth toe side is lower than your first one, then that basically means that your fibularis tertius muscle is weak. Although we have 3 fibularis muscles in our foot, which are fibularis longus, brevis, and tertius, they all perform our foot moving outward. However, we only focus on strengthening your tertius in this case because it is the only muscle that helps to bring your foot moving upward. So once your fibularis tertius muscle becomes stronger, then you'll notice your fifth and first toes align at the same height, which will decrease your pain. So here is how to activate the muscle. We simply bring your last toe at the same level as your first one. Then when you feel your muscle over here, then hold it for 5 seconds and we'll repeat 3 sets of 10 repetitions. So these tips can really make a difference when it comes to managing your extensor tendonitis. Give them a try. You'll likely find relief and improve your condition. So thank you for watching and subscribe for more videos. Thank you. Bye-bye.